In this video, we're going to talk about knee arthritis and specifically a treatment that potentially might help it, and that's platelet-rich plasma or PRP. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. And in this Ask Dr. Geier video, please understand I'm not giving you medical advice. This is meant for general information and educational purposes only. Arthritis is one of the most common conditions in the United States, in the world. It affects tens of millions of people here just in the United States. And there's other forms of arthritis like rheumatoid arthritis. So the percentage of people that have the cartilage in their knees, the bone under the cartilage starting to break down is really, really high. Typically the treatments we've been talking about, things like activity modification and anti-inflammatory medications, talking about cortisone shots, sometimes viscosupplementation injections like Synvisc, Suparts, things like that. Those are out there, but they don't seem to make the underlying arthritis go away. They're just modifying symptoms until basically it gets so bad that you need a knee replacement. But PRP, and it's been around now since the late 2000s, has been proposed as a way to help osteoarthritis, not just help pain and inflammation, but also to hopefully reverse some of the damage. Just so you know, platelet-rich plasma is a procedure where a nurse or medical assistant draws up a little bit of blood into a syringe. The doctor puts the syringe into a centrifuge that spins it, removes the red blood cells, removes the white blood cells, and what's left is the clear yellow part of blood in the syringe that has platelets, and the platelets are re-injected into the knee. They release all their growth factors and help cause whatever you're trying to do. If it's a tendon or ligament injury or muscle injury, is to try to get that tissue to heal. In the case of PRP, most of the early studies were looking at decrease in pain, decrease in symptoms, and some studies showed it wasn't that helpful, but some showed that it actually, and especially the more recent studies, showed that yes, it can be very helpful for decreasing pain, decreasing inflammation, improving function in patients with knees with osteoarthritis. And there's a lot of challenge with the literature because there's so many ways to create PRP, so many different concentrations, how much volume is administered, do they have white blood cells in it? Do they have red blood or no white blood cells in it? Does it have anticoagulant? There's a lot of different factors that make the studies very difficult. But again, some of the newer studies especially do show some good benefits in pain and inflammation with PRP. But on top of that, where the interest is really heading is, can PRP actually heal injured cartilage? And there are some studies that show that PRP is good for stabilizing and bolstering what's called the extracellular matrix that holds the cartilage cells together, which can be beneficial for trying at least to reverse some of the damage. Other studies have looked at whether they have an effect on bone and cartilage stem cells that are already in the knee. Another area that I would be interested to watch in the next couple of years is combining PRP with other treatments that work as stem cells or stimulate the development of bone and cartilage stem cells that are already in your knee. Treatments like exosomes along with PRP, or treatments like a common peptide, AOD 9604, in addition to PRP. That to me seems like a very exciting future avenue as far as treatment of knee arthritis, trying to avoid things that short-term benefit but much bigger long-term harm like cortisone shots, and certainly hoping to avoid knee replacements. If you like videos like this about orthopedic injuries, sports and exercise injuries, and overall health and wellness, subscribe to my YouTube channel. Click the bell to be notified when I start a live stream online or when I release a new video. If you'd like to see me as a patient, I'd love to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I see patients in Charleston, South Carolina and Charlotte, North Carolina. There's a link in the description below that'll take you to my website. In the upper right corner of the page, you'll see a drop-down menu that takes you to my contact page where you can fill out a form to find out more information about seeing me officially as a patient or other ways that we might be able to work together. Thank you so much for watching. I look forward to helping you feel and perform better than ever.